Parkinson's disease is a slow progressive disorder with no cure. This is the most common degenerative disease of the nervous system. In Parkinson's, specific neurons in the brain start to malfunction. They make less of chemical called dopamine. It's not produced in sufficient amounts. It also plays a role in sending messages to the part of the brain that controls movement and coordination. There are two risk factors for Parkinson's disease. The generic risk, which is under for the over 65 years old. This is the most common in people over 65 years old of age and can affect younger people as well. Patients under 40 are classified as young onset Parkinson's and make 10 to 15% of all cases. Next is heredity. Risk factor can affect for environmental risk. First is person exposed to pesticides, high dairy and milk intake, and have head injury. In most cases, they believe Parkinson's is due to combination of generic changes and environmental factors, with the young onset patients perhaps having a strong genetic contribution. Parkinson's symptoms divided into two types. First is motor or movement related and non-motor symptoms. Non-motor symptoms might show up earlier but can occur through the disease. First is loss of sense of smell, sleep problem, constipation, and depression. Motor symptoms of Parkinson's disease. First is tremor. It's not always present but can be the most noticeable motor symptoms of Parkinson's disease in many cases. This is usually the hand at rest but can also be present in the legs or even the chin. The resting tremor of the hands is often described as pill rolling with the thumb and other digits involved. Other motor symptoms include slow movement or bradykinesia, changes in postures and trouble with walking and balance problem, stiffness, and reduced face expressions. Motor symptoms usually start on one side of the body and can spread to the other as the disease advances. Stages of Parkinson's disease. There are a variety of rating scales that Parkinson's specialists sometimes use to track changes over time. Doctors sometimes divided the diseases into 5 changes. Progression is typically slow but can vary from patient to patient. First is mild symptoms. Usually tremor and other symptoms affect one side and reduce little disability overall. Second is symptoms make daily activities more difficult. Movement problems are on both sides of the body. Postures and walking can be affected. Disability is mild. Stage 3, movements are moderately slower. Balance is more affected, which put the patient at greater risk at falling. In stage 3 also, they are experiencing difficulty getting dressing, bathing, and do the daily activity. Next is for stage 4, significant mobility issue requires to use walker to move around. Patients need considerable to help doing daily activities and are unable to live independently. Stage 5, balance and movement problems are severe enough that the person needs a wheelchair and caring or needs nursing care. There are also have noticeable mental changes like delusion or hallucinations. Learning about the stages of Parkinson's disease can be frightening. However, not everyone with Parkinson's disease will progress to stage 4 and 5. This is too important to remember that the affects everyone differently and you may or may not have all possible symptoms. There was a the doctors treat Parkinson's disease with medication to relieve symptoms. Starting this medication does not slow the progression but can provide benefits to patients that improves and maintain their quality of their lives. Advanced therapies such as surgical implantation on a deep brain stimulator may also help in select cases as well. We also need to assist their activity daily living, the way they walking, running, and last is coping and support. All patients with Parkinson's disease, we have to support them and feel that they can we are always there to support.